Helene Fronick. Welcome to Doc Talk, San Diego County Medical Society's webinars on enhancing communication in the healthcare setting. For our first Doc Talk, we talked about making the best first impression on our patient, knowing that this is something that's going to color everything that comes next and that it sticks around a long time. For today's segment, I thought we'd move on to what comes next, eliciting our patient's chief concern. This is my favorite opening question. How can I help you today? I like it because it avoids the ambiguity of something like what brings you in today, and because it contains within it a message that I'm there to help my patient. Whatever your opening question is, we've all had this happen to us, I'm sure. We walk into a room and we ask our patient why they've come. They tell us, and so we take their history, we do a relevant physical exam, we sit down and talk to our patient about what they have and what we think they should do about it. We answer all their questions. We're feeling pretty good about the job we've done. So we walk over to the door, we put our hand on the doorknob, and our patient says, "Doctor, there's something else that I'd like to talk to you about today." And as we grit our teeth knowing that this is going to put us even further behind in our schedule, we think to ourselves, why didn't you tell me this before? And the answer is that we didn't ask. The reason we don't ask is that we assume that the first thing that our patient tells us about is the most important concern. But unfortunately, that is often not the case. Maybe it's the last symptom that's developed in a whole series of concerns. Maybe it's something that they heard someone talking about in the waiting room. And even more importantly, maybe our patient's testing us. They want to make sure that we're compassionate, caring, competent enough, trustworthy enough for them to share what's really on their mind. So how can 42% of situations, the first thing that our patients share with us is not the reason they've come to see us. So how can we avoid these dreaded doorknob conversations and make our time even more efficient? Very simply, by using a technique called scanning or screening. And that's simply saying, "Okay, Mrs. Jones, so you're having some back pain. Is there anything else that concerns you today? Okay, so aside from the back pain and the headaches, is there anything else that you'd like to discuss?" And we just keep asking the question until we have our patient's whole agenda. Now we know that some agendas just don't fit. We may have a 15-minute visit scheduled, and our patient, after we ask them and elicit all of these concerns, has about 8 or 9 things on their mind. That just isn't going to work. But then, armed with the knowledge of everything our patient is concerned about, knowing what we feel is more important medically and what seems to be bothering the patient the most, we can prioritize. We can establish an agenda for the visit, and we can very explicitly tell our patient what we're going to do today and what we might need to defer till the next visit. "Mrs. Jones, it sounds to me like the headaches that have come on so suddenly really need to be looked into. And it also seems like the trouble that you've been having with your sleeping is affecting a lot of other things in your life. So why don't we spend today's visit talking about those things, and next time when you come back, we can discuss your back pain, your rash, and your dry eyes. How does that sound?" By making this very explicit, our patient knows what we're going to be covering and what we won't. They know also that we're not ignoring their complaints, we're simply deferring them to the next visit. And by asking for their participation in the agenda setting discussion, we're using a skill called partnering. Doctors who were able to successfully partner with their patients had increased patient satisfaction scores and decreased risk of malpractice claims. For those of you who are interested in learning more about this subject, here's some great references. The last reference in particular is a terrific little book chock full of excellent communication ideas. And I'd like to invite each of you to subscribe to my communication blog at helenefronickmd.wordpress.com. I'm Helene Fronick. Thanks for joining us for Doc Talk. I hope